Good afternoon. This is Tracy Morton. I'm the Director of Population Health here at the National Rural Health Resource Center, and I'm the Program Manager for TASS, the Technical Assistance and Services Center, and we're the technical assistance provider for you, the State Flex program. So really happy to have you part of this conversation today to talk about the template that was provided to you for your Flex Notice of Funding Opportunity submission. So our purpose today is to really kind of explore what this work plan template looks like, its instructions, its layout, some of the sample content that's included in there, and then an opportunity for you to have kind of a live question and answer session with the staff here at TASC, as well as Sarah Young and Christy Edwards are also on the line representing the Federal Office of Rural Health Policy. We'll do our best to answer your questions today. I encourage you to use *2 to unmute your line when you do have a question. Please do remute your line by pressing *2 again, just so we can kind of manage the sound quality. You can always use the chat box as well, too. So please do ask questions as we move along. We'll spend the first part of our time here together this afternoon talking about the Flex submission. And then later in the call, we'll also touch on the EMS supplement as well. So I'm actually going to share my screen with you so that you can see the documents. And I know that this may be kind of tiny, so I'll do my best to make it so that it's not incredibly tiny. And hopefully you all can see that now. Nicole, can you just let me know that you guys can see that?
Yep, I see it.
Okay, perfect. Thank you.
Black spot there, though.
All right, that was
okay. There
my
it is.
Adobe window. Okay. All right, so the first thing I wanted to be sure to cover was where you can find these resources on the website. So this is the website for the National Rural Health Resource Center. It's www.ruralcenter.org. And if you're on our main landing page and come down here to programs, if you click on that, then over here on the left, you'll see the link for TASC. That takes you to the main landing page for TASC. If you haven't already bookmarked this site, please do. There's a ton of information on here that's relevant to your program. It's specifically designed content for Flex. On the right side is the navigation for the materials within the TASC page. And you can see the third major link down is Flex Program Grant and Cooperative Agreement Guidance. So if you click on that, you do need to scroll down quite a ways. And the purpose for having some of the old stuff up here is we are still in kind of the current grant cycle right now that's representing the 2015 grant guidance. So a lot of those materials are still on here for your reference as you kind of live out your Flex program now. But if you keep scrolling down, you'll see the materials then that represent the cooperative agreement that you're writing your submission for right now. So down below here, you'll find links about what the Notice of Funding Opportunity included, some of the categories and program areas, some of the program structure, and then some of the template tools, as well as down below here too, also the EMS materials. Webinar recordings are also being placed on this page too, so do take a peek at this. So that's where you can find materials. So first, I'd like to move into some of the instructions that are relevant to the Flex grant application itself, not the EMS one, but the Flex one. And I'm just going to pull up the template here. Okay. So I'm talking about some of the instructions that are not only in this document right now on the first tab, which is the instructions tab here on the left, but also some of the instructions that are in the Notice of Funding Opportunity announcement. So the work plan itself is an attachment. It will be submitted as attachment 1 when you complete your application. Your total application for the entire materials is 50 pages, and that includes the attachment. So please be really cognizant of that in your writing. The work plan is meant to be a really succinct overview of your program's objectives, its goals, and the activities you'll take to achieve those goals, as well as the projected outcomes, what demonstrates that you've made a change. It's in a table format. It is not in a narrative. You do have a narrative section that is separate from this, and the narrative is where you describe the activities a little bit further and also provide the justification about how your activities are meeting the needs of your communities. That kind of content does not go in the work plan. The template that we'll be reviewing today is highly suggested. If you submit it in a different format, it's possible that your project officer at FY19 may come back to you at a different point in time and ask you to do it in this format. So it probably behooves you to just use this template as it is right now. So the first page on the template that I'm showing here just has some of the high-level instructions. I'll talk about these a little bit further as we go through here. There's some color coding in here that's just meant to make it more visually easier to orient throughout these different documents. And then there's a series of different tabs. So there's a 5-year performance period, which we'll talk about. And then there's a performance year, which is for fiscal year 19. There's also subsequent tabs for the other performance years, and we'll talk about that in a minute. One instruction, I'll repeat this multiple times, is as you're filling out the materials within the 5-year performance period in your fiscal year 19 performance year, only include the program areas and activity categories that your program is addressing. If you're not doing work in a particular program area or some of the activities that are in this template, you can delete those. Again, you want this to be succinct and you really want to pay attention to those page limits. So what we'll do is we'll walk through this template and then I'll kind of provide I'll walk through a little bit of the samples that are in the sample template as well, which just has example content put into it, and answer some of the questions that we've received so far, but please do interrupt and ask questions as we move through this. Let's see. One other point regarding this instructions page is that you do not need to have the instructions page as part of your submission to the grant application. Take it off. It actually would count towards your page limit. So just with this, right click and delete the tab when you submit this document in. We'll talk a little bit further later on about submission. So first, we're going to move into the 5-year performance period unless there's any questions about this instructions tab. Okay. Nicole, I think I might need some help with field. Oh, here we go. So
What's wrong, Tracy?
So yeah, Nicole's correct that you will need to call into the telephone number to be able to hear the audio portion. Nicole, you want to address that quickly?
Yep, you won't be able to hear or verbally participate if you don't call into the phone portion.
Which they probably can't hear this, so thank you for taking that out.
Oh, yeah. Well,
yep. Catherine's question from Wisconsin, do we need to include the CH designation area? C is optional. Yes, so if you have hospitals in your state, Catherine, that could still convert, then yes, you will need to include that in there. Because if they approach you, you want to be able to have time designated to be able to do that. If you have 0 hospitals in your entire state that aren't going to be converting anymore, then that wouldn't be applicable. And then I'll talk about the submission later on, Catherine, so we'll get to that at the end of the call. Okay, I'm going to move forward and start talking about the 5-year performance period. I see one quick question, I'm sorry, here from Lisa. Since there will be new grant numbers, should we include our current grant number? No, you should be including your new grant number. Sarah, please correct me if I'm wrong there, but I would think that you would be including your new grant number, not the old one.
Ideally, yes, but this is Sarah. Thanks, Tracy. Good question. You won't actually have a new grant number yet because of the way the system is processed. That was actually a thing we only found out recently due to HRSA internal processes. So you are welcome to just go ahead and leave that piece of the header blank because obviously you can't complete it.
Okay, perfect. Thank you. And Jill just inserted a comment that they had a hospital that kind of downsized, if you will, to become a CH. So yeah, that's something for us to all be aware of, that some of our other rural facilities could reduce their size to want to convert to. So thanks. Okay, and so moving over, oh, go ahead.
Oh, since we're addressing Jill's comment, it's a good idea to include those potential placeholders for CAW conversions, but as you were saying, Tracy, that can be really short. You don't need to spend a lot of time on that if you don't have expected plans there.
Mm-hmm. Okay. So moving along to the 5-year performance period. So this covers all 5 years of the application that you're writing for. It's a very high-level view. The instructions that I'm providing are from both the instructions that are here in this Excel template, also from the instructions that are in the NOFO with a little bit of interpretation as well too. But mostly it's all there. So this is what just the template looks like. So as you can see at the top, it's designated by the different program areas here are highlighted kind of in the bolder color, and then there's some faded color for the other ones. So the quality improvement area is blue, scrolling down quickly, financial operational is green, et cetera, et cetera. Again, if you aren't doing work in a particular program area, like say you aren't doing anything related to EMS or population health, you can certainly just omit that portion, delete it out of your work plan because there's no need to have in the extra content. Within each of these, you would write in goal statements. Please take these goal statements directly out of the Flex Grant application. There is no reason really to rewrite these for your organization. They're pretty straightforward already in the NOFO as it is. And this is really what your program is working on to address within the activity. So keep those in mind. There's a table here at the top that's meant to be kind of a quick glance at what it is your program might be doing in a particular year. So this area here, again, is about quality improvement or the MBQuip project, as we all are pretty familiar. And you would, in each of these cells, be able to click and say whether or not you're doing a particular activity within a certain year. So what I just changed probably doesn't make sense. It's likely that you're working on all 4 of these first activities, 1 through 4, and probably likely all 5 of your program years. But maybe it is that in year 1 and 2 only, you'll be working on the patient safety measures. So you would just click on those with the drop downs there to be able to say that they're active or that you are working on them then. Below, you'll find a spot then for an overall description of the program approach. So again, this is a very high-level overview of the strategy for your program in this particular program area to meet the goals of the program area. So be very succinct. The detail, the why, really goes into the narrative section. Below that, you'll find space to write in your outcome measures. The instructions are that for the entire program area, so for this example, for all the work that you're doing related to quality improvement, choose 1 to 3 clearly defined outcome measures to track and report on. So not 1 to 3 per different activity. So not 1 to 3 for activity 1.1 and another 2 maybe for activity 1.2, but for all of the different activities that you're addressing within that program area, choose 1 to 3 overall outcome measures that you want to be able to see change in. They should really be time-based targets, and I'll explain a little bit more about what's in the cell here that's highlighted right now. So the label here is just A, indicating that it's kind of your first outcome measure. Within the concept, that's just essentially the outcome measure description. The data source is where the target baseline in the reporting data will come from. So within this area here for quality improvement, this is kind of an easy one, but most of your data will likely be coming from MBQuip reports, the data reports. The data timing is when you access the data. So for example, for MBQuip data reports, this would be maybe the specific reporting period or the time of year that you would be accessing the reporting periods to create your baselines. If you're going into Compass, for example, to access data, maybe you'd say that every March you'll be accessing this data or every January or something like that. And if in a different program area, say in the area of population health, you'll be using community health needs assessments data. Different critical access hospitals have different cycles of when they complete the community health needs assessments, and they're not all done in the same exact month, but maybe it's every, say, July, you look at the community health needs assessments that exist for your state at that time. So that's a little bit about when that data timing is. It's when you're gathering the information. And then the measure population is really who are you collecting all the data from? So is it all the critical access hospitals in your state? Is it a subset of the hospitals that are participating in a particular activity or activities? Does it include your rural health clinics or EMS agencies? Who is represented within the data? For the Notice of Funding Opportunity submission, you will submit your baseline data and your target data for each of the outcome measures that you have within your program areas. years 1 through 5 then would be reported as the activities are completed, as you kind of start to gather your outcome measures. Again, if you're only doing a particular activity that you're really looking for outcomes on in just 2 years, say, of your Flex grant, then that's fine. You would only gather outcome measures for that thing within years 1 and 2. Penny, I saw your comment there. We'll look at a sample here in just a second about what some of the examples might look like. Related to baselines and targets, try to avoid to be determined or TBDs. There were certainly a lot of those submitted last time, and certainly at tests sometimes we do that too. Sometimes we just don't know what a project is going to do or how it's going to turn out. But really do your homework, try to find the data that you have available to you. Use that data that really helps you to justify why in the first place you're choosing to do the activity and how it's really guiding your work, and that can help you get to what your baseline is or identifying appropriate targets. We're certainly here to help you as well. If you have questions about appropriate outcome measures to use, thinking again about the outcome is really not the things you want to count, but it's the things that you want to count a change in. So looking at assessing a change over time, there are examples in the Flex structure document, which is on the task webpage, which I just showed. So take a peek at those. You don't need to recreate the wheel. There are some great examples already in there. Or if you have questions, you can reach out to Task, and we're here to help with trying to have a conversation with you about what some great outcome measures could potentially be. So again, you would fill in each of the program areas in this 5-year performance period. This is the high-level goals and outcomes that you're trying to achieve within each performance area over the entire 5 years of the project. Again, omit anything that you're not working in, but keep the, say for example, I was doing work here in program area 2. Maybe I'm only doing work in the required area and nothing in anything else. You certainly could delete these rows here that I have highlighted right now if you really wanted to. You would, of course, still need to have outcome measures. But then if you're not doing any work in any of the optional areas, you can just delete those entire rows from this document just to save yourself some space. Let's see. So with that, I'm going to flip back to the Adobe Connect. I can see some chat questions here. Let's see. So Lisa said, should that be accessed rather than assessed? I don't even remember what word I said here, Lisa. So it would be when you're sourcing the data. So data timing is about when, you access the data. I would assume that you're interpreting at the same sort of time. Sarah, do you have anything to weigh on that? I guess that was my own interpretation there.
Yeah, Tracy, this is Lisa. In the sample where it says data timing, it says assessed in March. But we're not doing an assessment. We're accessing it, right? If you look at the sample document you gave us.
Sarah,
Sure, I can speak to that a little bit. What assessed is trying to get across in the sample we put together is basically this is when you did the work to calculate it. You could also use analyzed. Certainly not trying to imply a big multi-level assessment or something, but
no, I was just trying to clarify because Tracy had said indicate when you access the data, but here in the sample it says assessed. So I just wanted to make sure that we're doing the right verb.
Use the verb that makes sense to you.
Okay.
The point of this is to really put some actionable information around that outcome measure description. So both so that you are demonstrating that you know how you will be collecting and compiling the data, to use a different word, for the measure that you're reporting, and that you can show your reader that you're doing that, and so that you have a reference next year when you're like, now when was I supposed to do that, and what period of time was I supposed to use for this calculation? That should all be in this 5-year part of your work plan, so it's easy to execute each year. It really lays out what you need to do to calculate that measure and report it, which is why this template includes specifying both the idea of what we're trying to measure, whether it's a measure of patient engagement among critical access hospitals, or a measure something about critical access hospital behavior or data reporting timeliness, and where the data is coming from, when you gather the data, and potentially, since a lot of the times we're doing look backs, what period of time, what period of data are you using for each year, and then the population, what's it about? So this is really a recipe for compiling that measure each year, so that you know that you're doing it the same way every year, and it's planned out and easy to execute. Does that make sense? And yes, to Stephanie's question, annually, just saying annually would be too vague. Calculated each year in January is, again, tells you what you're going to do and when.
Thanks, Sarah. I didn't mean to take up so much time with such a basic question. Thanks.
It's not a basic question. Outcome measures are hard.
Penny, we will still get to your question about concept. Jennifer from California said, for patient engagement, there are a lot of data that we look at. How do you appropriately choose only 3 when we're working on all the measures? So that's a good question, Jennifer. So one approach, I guess, when you're thinking about things is, what is it that you're trying to do regarding patient engagement? Are you trying to get more hospitals to improve in their reporting frequency? Are you trying to get them to improve on measures? And with patient engagement, and I'm assuming you're meaning HCAHPS with that, there is kind of the roll-up score that could be created too. So again, you don't have to have an outcome measure that addresses each of the different 8 activities that you could be doing within the quality improvement area. You need to have outcome measures that address 1 to 3 of them. So you just need to choose for your program which is most applicable. For any of your activities, you will have to have output measures, and we'll talk about that in the performance year thing too. So you can be monitoring progress that way, that can be rolled up into overall performance improvement. Let's see, Marcy in Colorado said, if you plan to work with a cohort that will be determined based on a readiness assessment, isn't acceptable to put the state average as baseline, but put to be determined in the target, which will be based on which CHs join the cohort. Yes, I think that makes a lot of sense to me, Marcy. If you know who will be participating when you're writing this, then create your target then. If you do not know and you will be adjusting it based on what those scores are representing that cohort, that makes a lot of sense to say that. Just be clear in describing what it is that you'll be doing.
And one thing, this is Sarah again, that I would urge everyone to think about when you are thinking about outcome measures is try to take a step back from the specifics of individual activities and activity categories, but to say, what am I trying to accomplish with the Flex program for my state? What would I actually like to see different because of my work next year and 5 years from now? And what do my stakeholders want to see different? And if you can articulate some of those bigger picture goals, that can give you an opportunity to identify outcome measures that are really relevant to you and to your stakeholders, and that are something that spans all 5 years of your project period. I would say that you certainly can propose cohort-based outcome measures when appropriate, but you need to be careful when you're thinking about those. Really, for outcome measures, we're looking for something that you can track and trend over all 5 years of the period of performance for activity categories that are active for all 5 years. So if you get too specific with individual cohorts, you really frequently are going to make it really difficult to track and trend over multiple years.
Thanks, Sarah. Ali, it looks like your question was answered in the chat box. FMT financial data is generally available in February, March each year, so that should be coming out anytime. That does include the specific metrics for your hospitals in your state. It also includes updated national medians as well, too, which is really important for targeting. Jen had a question, it looks like, about the templates and formatting in the templates. So yes, so the template itself does have extra pages and columns within it. You will need to delete those and adjust those with formatting to meet the pages of content that you actually have. So we didn't go in and par down the pages. We removed the blanks to the best of our ability for getting this out in a timely fashion, honestly, but you will need to do some editing on that.
Also, to the point, there's 30 pages when you look at all 5 years of template, but you don't need to turn in 5 years in this application. You should only be turning in your 5-year period of performance sheet and your FY19 sheet, and together, as they're laid out right now, that's about 8 pages, I believe.
Correct, yep. And we'll get, again, like I said, to submission stuff in just a little bit, guys. So the other question, Jennifer from California said, would you prefer overall state baseline data, or if you're only working with a subset? That's relevant to the project, so and the activities that you choose. So if you are, you know, Jennifer, I think that's kind of a case-by-case basis of really what makes the most sense with the activities that you choose, and then how you would roll that up into outcome measures. So certainly when you are, you know, kind of have specifics or whatever, give us a call or send us an email here at Task, and we can just kind of brainstorm together which is most relevant. Okay, I'm going to skip any of the questions about submission until later on. Catherine, I see your question there, and I want to address Penny's question about concept. So I'm going to just pull open quickly the sample table that is the 5-year work plan. So again, this is in the on the Task website as well. It looks pretty much the same with the instructions the same. So for the 5-year performance period for the sample, I'll just walk through the quality example. So this is just for a made-up state and a made-up program. We try to keep it pretty simple, but again, your content that you're submitting with your work plan should also be simple and succinct. This particular program is doing just the required activities within quality improvement for all 5 years. So from the drop-down boxes here, they've just selected active for those that are relevant. The overall description about what they're trying to do is to build capacity, reporting all MBQIP core measures, and focus improvement projects on measures where CH perform worse than the national average. So they're looking to compare nationally. And then I believe, yep, this one has just two outcome measures for this. So for a concept, again, the concept is kind of the definition. It's your measure definition for your outcome measure. So for their concept, their outcome measure is the number of CHs reporting on all MBQIP core measures for the previous year. So we had some questions about this specific example. They're essentially in this state looking for all or none reporting, if you will, related to the core measure. So they're looking to have as their opportunity for improvement, or their change that they're wanting to see, is they want to see a change in the number of CHs that are reporting all MBQIP core measures for the previous year. So their data sources, they're looking at the applicable reporting quarters for flex eligibility within specific MVQuick reporting periods. They're going to look at it each year in March, and they have 50 CHs in their state. So their baseline that they're submitting with their NOFO is that right now they just have 5 of their 50 CHs, or 10%, are kind of reporting all of the required core measures. And their target is they have a big stretch goal for 5 years that they want to get to 80% or 40 of their 50 CHs. So they have in here when they access the data, so they're pulling data from March 2018, and then their target, which is kind of the end of the NOFO that they would be submitting data on, would be March 2023. So each year they know exactly when they'll be pulling the data, and then they would input the values as it goes along. The second outcome measure, and sorry about the page break here, for their outcome measure, or their concept is they're looking at the number of CHs that are meeting all 7 antibiotic stewardship core measures. So they'd be accessing this through the National Health Service, NHSN. I'm not even going to get the acronym right today. It's Monday. So they're looking at that for the previous calendar year, and they're looking at their survey data as well, survey data that's available, and I see a typo there, by April of each year. And again, they're looking at the 50 CHs in their state. So their baseline for this is that they have 10 of their 50 CHs that are right now reporting on all 7 antibiotic stewardship core measures, or that are meeting all of them, and they want to get to 100% by year 5. So they're looking at their data for a calendar year. NHSN data comes in a calendar year, and they're accessing it in April. And then again, their years kind of line up with when they would be looking at it going forward. So,
and one thing
that. Go ahead, Sarah.
One thing that this example does a nice job of showing is it's giving you a recipe. It helps you understand what you or other staff people in your office who are working on this report next year need to do to update it. And it shows that you have a well-planned measure because you know where the data is coming from, you know what the current state is, you were able to establish a stretch but realistic target. It kind of puts it all together in a fairly succinct place.
Yep, and I'm going to scroll down. I think there's one down here I just wanted to show. Here we go. So in this sample too, what I wanted to show here is that they have, this is the EMS activity area, or program area, program area 4. And this state they're doing, all 5 years, they're doing activity 4.1, so the statewide rural EMS needs assessment and some action planning all 4 years. And then only in 2 of their years, they're doing activity 4.3, so some EMS operational improvements. So I just wanted to show what that chart can look like there. And they're actually going to be working on, is their operational improvement activity, some time critical diagnosis. So that's kind of described as in here in their overall description. And then they have some, just one overall outcome measure is so that for this particular area, and again, not to overcomplicate things, but they're looking at the time critical diagnosis patients outcomes in the participating EMS service areas. This is a pilot project they're going to be implementing, and so their data source is data reports that they would get from the pilot project participants. They would get that data reports at the end, so in 2020, because it's going to take them 2 years to do the project. And then their measure population is the rural EMS agencies and the CHs that are participating. So their baseline for this one is they don't have any EMS agencies of the 24 that are in their state using these Get With The Guidelines programs for for stroke and STEMI. But they're hoping that they have 2/3 of them that are participating or that are using them by the end of the year. And so that's just the measure that they'll be monitoring then for the time going forward. So that is what the 5-year performance period looks like, and with some samples. I'm going to flip back, and we're going to talk about other tabs in this worksheet. So I'm back here on the template again now. So again, there's the instruction plan, the 5-year performance period, and then there's the fiscal year 2019 performance period. So the template, as Sarah mentioned before, it actually has individual performance years for 2019 through 2023. So that's the whole life of this 5-year cooperative agreement. 2019 is what you need to report now in March. The rest of these tabs are just there for your convenience. So you'll save a copy of this on your local computer or your local intranet at work. But when you submit the document to the federal office through grants.gov, you'll only submit the 5-year performance period in the FY19 performance year. So in what is happening, to walk through this layout here in the performance year, this is for succinct descriptions of the planned activities in each of the program areas. So again, delete the content in here that you don't need. If you're, for example, if this one, if your program is only doing the required areas 1 through 4 or 1.1 through 1.4, then delete the rows for 1.5 through 1.8. You don't need that extra just blank space there. In this template, there are just 3 spaces here for you to describe the specific activities. If you need only 1 row to describe your activity, fantastic. If you need 8 rows to describe your activities under 1.1, add them in there. Again, it's just a template, so use it as you need to. So a little bit about the layout for each of these. So the colors in this follow the colors in the 5-year performance period. The first column here is for the description. So here you would just include a brief description about the planned activities. The next column over is for expected outcome, or excuse me, expected outputs. So this is what you plan to measure to show the process of the activity occurring. And we'll talk about some examples of what that looks like here. Actual outputs, you'll leave this blank for now because this is what you would fill in once the activities occur. And so for right now, you'll leave that blank. It will be populated when you do your progress reporting. Then over here, we have the column for timeline and key milestones. So the timeline would be what quarter or what particular month is an activity or an event occurring within, or maybe it's an ongoing thing, then just say it's ongoing. But if you have specific deliverables, if you will, specific things that are happening related to the activity, this is where you would note where those are. And this helps you track the progress. Let's see, and then staffing is which staff, either within your office or within your subcontractors, had the primary responsibility for completing the activity. Each particular activity, kind of in this, the lighter shaded color for 1.1, for example, have a total budget for that category. So you would roll up the costs. Say there was 3 different activities listed within 1.1 here. You would roll up the total cost and list them here for 1.1. The overall program area also has a budget, so you would roll up the cost for 1.1 and 1.4, or 1.1, 2, 3, and 4 together, or whatever it is that you had, into one overall budget for that program area as well. So I'm going to flip over to the sample. We'll talk about that a second here and then answer questions. So in the sample template that's provided on the task website, there's the instructions tab, just a 5-year performance period, and then only a sample for fiscal year 19. So we'll just look at maybe this first one here again under quality improvement. So this is representing their same fictitious state flex program. So if you recall from the 5-year performance period, they're doing activities in program area in activities 1.1 through 1.4. So just to walk through the first one here and not to spend too much time on it, but under reporting and improving the core patient safety or inpatient measures, they're going to conduct some educational webinars to which they'll be expecting that all 50 CHs that attend or will receive meeting notes and resources during each of the quality meetings. Their timeline is when they'll have these done by is the end of August or the end of the performance year, and it's led by work through their flex coordinator and a subject matter expert. Also related to this particular activity is they're providing one-on-one TA to facilities on reporting questions and quality improvement opportunities. They're gonna, as a output measure, just kind of monitor the number of TA requests. They're expecting to get about 30. And the purpose of having expected there is twofold. It allows you to anticipate if you're kind of over or under when you're planning it out next year. We use this a lot in tasks. It's kind of like your target, but we even use it for outputs because it helps us to monitor where we're spending our time. If we expect that in tasks we're going to get 800 TA requests in a year, and then we get 600, well, that lets us know that we really need to delve into that a lot deeper and see where our time was spent and what happened and what changed because of that too. It also lets your project officer know where a lot of your time may be anticipated spending just because of quantities of things, and the reviewers as well. Their timeline for this, because it's TA, is ongoing and would be as requested, and it's going to be led by their flex coordinator. You can see for activity 1.1 here, they're anticipating that this costs $25,000. The numbers in here are pretty generic. We just rounded them to kind of very whole numbers, if you will. But your budget will likely not look that cut and dry. And then when they add up all the costs that they are expecting within their 4 different activities within Program Area 1, their total amount of money spent in Program Area 1 is $110,000. So I saw a question pop up. I'm going to flip back over here. So Catherine had a question about the target. The target is where you want to be after year 5. Yes, Catherine, the target for the performance year in the 5-year performance period would be where you want to be after year 5 if you have 5 years of work to do within that particular outcome measure. If your outcome measure is for a set of activities that's only going to be for 3 years, then your target would be where you want to be after those 3 years are completed. Alia is asking if the total budget should include any staff salary. If it's only staff time devoted to it, yes, it should be representative of your entire budget for your flex program. Sarah, is that accurate?
Ideally, yes. And really, this is a tool to help you complete your PIMS reports, which also ask for expenditures by activity category.
Okay. And then looks like Tricia in Alaska has a question about the budget justification narrative. Let me pull up the guidance right now, Tricia, unless you know off the top of your head this one, Sarah.
The budget justification is a different document. And there are 2 different budget-related documents that you need to submit in grants.gov. One is the SF424A, that standard form, and that does need to include a budget for each of the next 5 years, as was demonstrated in that example document that I shared in our webinar a week and a half ago. The budget narrative is your written or possibly bullet pointed explanation of the different spending you have planned for this year, and it doesn't need to go into a lot of detail about future years, although if you show major changes in year 3 or something in your 424A budgets, you may want to explain why that is happening.
Thanks, Sarah. Let's see. Montana has a question about how do you reflect work that addresses multiple activity areas. So thanks for asking that. Sarah and I were actually talking about that prior to this call. So the way the template is laid out, it doesn't allow in the space that's provided there to, unless you want to repeat something over and over and over, which you could, I guess, you could repeat out that you're doing a particular activity and it's relevant to a variety of different activity categories. I get that that's redundant and actually uses up space that might be of good value to you. So one thing that you could do is within the first activity on the table where it's where that particular thing would be relevant, you could say what it is and describe it and describe what your output measures are, and just have a notation that this applies to, this will not be repeated below, but applies to the following activity categories as well too, and just notate that out for your project officer and the reviewers to see without having to replicate it throughout the document. So kind of the best suggestions there. As long as you're clear about it, I don't think you should have any problems, Jennifer. And when you, if you have your specific example, again, reach out to us and we can help you walk through formatting or different ideas on that.
Yeah, this may
Kayla,
be...
oh, go ahead, Sarah.
Oh, I was looking at Kayla's question on the budget. The budget numbers on this work plan document are not meant to be super specific. They're category level, they're approximate, and they're forward-looking. They're not, actual expenditures. So be clear with yourself how you're completing it. But just like we have that budget tool for completing PIMS, where you have the sort of spending that is directly applicable to each activity category that you can record in the PIMS budget tool, which is not something that Tracy or I have pulled up, but is another document available on the task resources page. And then your second step in using that PIMS budget tool is to record and allocate the spending that's not specific to individual activity categories. My recommendation is that for this work plan, you're going to record the spending that's specific to the activity categories, but you won't necessarily include the non-specific stuff. So if you have staff time specific to an activity category, that's absolutely part of your resource investment in that category. Travel costs for the reverse site visit really apply to everything. If you have, again, specific context or situational questions about how to use this template with your other pieces of your application and your reporting, please reach out to task or to your project officer, and we can help you think through those individual situations. And Nicole even put up the link. Thanks, Nicole. Are there any other questions in the chat box, Tracy, that we need to answer?
I think we're good. I was just talking away on mute. So I think we're good. The rest of them look like they're related to submission formatting. So on your screen now is the EMS supplement work plan. Just to talk through this, and then we'll talk about the submission process and some tips about that. Not everyone may be applying for the EMS supplemental project. Again, it has its own set of instructions to it. This is a 3-year performance period, so some things are similar to what we just talked about as well. So there's an instructions tab in this work plan, as well as a 3-year performance period tab, and then a performance year tab, as well as blank ones for 2020 and 2019 as well. Nicole, do you want to talk through anything on these, or Christy Edwards?
Sure. I talked to Christy a little bit before this, but she can definitely pipe in if she has anything to add or if anybody has questions about it. But like Tracy said, on the first tab, there are instructions there similar to the primary flex work plan had some instructions there for you. Excuse me, if you go back to the 3-year period of performance tab, you can see that that is a little bit different than the flex work plan, as it's asking for monthly timelines for those activities. I believe that's similar to what a Gantt chart looks like, indicating kind of how those run on the timeline. And then Tracy, if you scroll down a little bit more on that same tab, there is, keep going. There you go. Here you can see that there are spaces for 3 outcome measures. Christy wanted to make sure you all noted that those are outcome measures for 3 years, not 1 year at a time when you're writing them in the left column there. And then when year 1 ends, you would go to the right side and fill in your actual values for year 1. Same thing with year 2, and then also with year 3 with your actual outcome information. And then Tracy, if you would switch to the 2019 performance year, this looks different as well from the Flex Work Plan. This isn't requesting budget information, but it is requesting your outcomes. So the actual outputs column is on the far right there, is not to be completed at the time of application, but you will update that at the end of the year. So I think those were the big differences between the 2 different work plans. If anybody has any questions, or Christy, if you wanted to add anything.
Yeah, just a couple of things. So first of all, I wanted to, again, tell you all that you need to choose one focus area or the other. It is entirely possible that some of the projects you have planned could reasonably be considered either project, either focus area 1 or 2, but you need to choose the one that best aligns with the goal of your project. The other thing about the outcome measures is that you need to choose a small number of outcome measures that apply to your entire project, that are going to tell you overall if your project achieved what you wanted to achieve. The outputs are for the individual sub-activities that you're working on.
And this is Sarah, I would say, just like what Christy said, we don't expect, neither in the EMS supplement or in the primary Flex applications, outcomes for each individual activity or intervention. That is not reasonable. As if you've made it to the end of the Flex structure document, we included a couple of pages on thinking about outcome measures and how you could define outcome measures over different time periods. And one of the key takeaways of that little chapter at the end of the Flex structure document is that most outcome measures take time to collect, and often they take more than 1 year. So we need to think about, really being aware of doing our program measurement over multiple time spans where we have those outputs, which are something you can report every year. We convened 3 meetings. We held 6 webinars. We provided technical assistance to 12 hospitals. But the outcomes are the longer term impact that that work is having. And that's hard. We really want to acknowledge that identifying meaningful outcome measures that resonate for you and for your program stakeholders and for your readers and reviewers is hard work. I don't want to minimize that.
I guess the last thing to cover, and again, if you have questions, put them in the chat box or press star 2 to unmute your line. There's some questions about submission. So when you submit I'm flipping back to the Flex Cooperative Agreement and its work plan, that gets submitted as attachment 1. So what you need to submit with that, again, is the 5-year performance period in the fiscal year 2019 performance year. You will want to, when using this template, you'll want to delete the tabs for instructions, and you want to delete the tabs for fiscal year 2020 through 2023. Again, those will count towards your paid limits. It's also best to convert it to PDF before you load it into grants.gov. That gives you a chance to make sure the formatting and the page layout length are correct. Excel does some funky things with wrapping text. We realize that there is certainly some limitations with using a work plan structure like this within Excel. Excel is really built for numbers, not necessarily words. So you'll want to check that out. I could even see, for example, in this EMS supplement, if we look back on the, this is a great example actually, if we look back on the instructions page, there's some content from some of these rows that are wrapping onto this page over here too. So when I would convert that to PDF, those would print on their own separate little page. Certainly not ideal. So you'll want to, you know, check for all of that and spend some time really with formatting. So certainly build that into your timeline and processes too. There was a question about whether or not you can upload separate documents in part of attachment 1. Sarah, can you put more than one attachment into attachment 1, or is it one file in and of itself?
I believe the way grants.gov works is it's basically one file per slot. What I would recommend is that you combine the multiple pages of your work plan into one single file so that it has the 5-year section and then the 1-year sections, and they have those nice headers so they'll be clear. Each page will be clearly labeled, and you combine that all into one PDF file and upload that single PDF file as attachment 1. That will definitely give you the best control over how grants.gov will interpret your files and spit them back out, because if you don't maintain control of that, you can't always trust the automated system to do it the way you want.
Other questions?
I've got a couple other points or just suggestions about submissions. We formatted these templates with color coding because as a convenience to you and to help keep us all following along, but be aware that sometimes reviewers like to print out their documents on a black and white printer and read them that way. So as you're filling it out, just keep that in mind. All of the current formatting should work just fine to print from color to black and white, but if you add additional color formatting or other changes, you know, be aware of black and white printing while you're doing that. And then one other point for black and white, would you pull up the 5-year EMS template again, Tracy?
Yep. 3-year.
And for your page, scroll up. So if you look at that sort of Gantt chart example in the multiple year timeline, how on activity 1, as well as having some shading in the cells, it has text to identify the start and end period for that activity. That's a good example of how to do something to make sure it will work if printed in black and white, while also being viewable in color. The PDFs generally convert to color and maintain that color conversion, but if people print it on paper, of course it will end up black and white.
Any other questions? Okay, and just a reminder too that in task we can certainly review a portion for you of your NOFO application. So that could be your narrative, it could be your budget, it could certainly be one of these work plans. We're happy to do that. If you would like us to provide you with a review of a section, we'll review it for content and for flow and things like that. We're not going to review for editing and formatting and typos and all that good stuff. But please, if you would like that, submit your request to us by March 15th. That's 2 weeks before the NOFO is due. You can submit it anytime up until then. We need at least 5 days so that we can review it, because we have 2 sets of eyes that look at each section that you send to us, so that it's just not one person's interpretation that you're getting, but that we're really providing with comprehensive feedback, and also recognizing we have other projects going on just like you guys do right now. So please submit it to my March 15th and we'll get it back to you within 5 business days. If it's closer to the 15th, we'll certainly try our best to get it back to you as quick as possible. We realize this needs to go through multiple steps in your organization. And as always, if you have any questions, you can email or call any of us, or you can email us all as a team at task@ruralcenter.org, and we're happy to help you out. So thanks so much for your time today. Thanks, Sarah and Christy and Nicole, for your information that you shared as well. And good luck, everyone, with your writing.
And if you have additional follow-up questions, please also send those to task@ruralcenter.org, or your project officer, or to me, Sarah Young, as the program coordinator. We certainly want to all be responsive as possible during this period and answering as many questions as we can.
And this is Nicole. You could also post them in the Flex Program forum so that your peers can see them all and see the answers to them as well.
Good point, Nicole. If you have a question, someone else does too.
Yep. Okay. Thanks, everybody.
Thank you.